reason I became a dermatologist is because of my own family's struggle with vitiligo. My younger brother, who is now a physician, was diagnosed with vitiligo at the age of 8. And we, being of Indian background and Indian Asian origin, vitiligo still is a very socially stigmatizing condition in that part of the world. And certainly 20 years ago or 30 years ago, it was even more so. So I think the importance of treating a vitiligo patient and educating them that this is a medical skin condition, that this is not a cosmetic disease, is really, really important. And to let your patients know that you do understand that this is really affecting them both psychosocially, as well as letting them know that you care and are going to try your best to get some repigmentation of their vitiliginous or depigmented skin. I think the psychological impact of the disease is oftentimes overlooked because we're very busy. We have lots of patients, and not because we don't want to address that, but we're probably not well equipped to do that as dermatologists. I think it's important to ask any new vitiligo patient, how does this make you feel? How do you feel when you're out in public? Do you like to wear shorts? Do you like to wear swimming suits or swimming trunks? Do you like to be outdoors, or do you like to stay covered? A lot of times I found my vitiligo patients, even in hot Texas summer heat, will come in with long sleeve clothing, long pants, sweaters, tops, and jackets. And you don't even have to ask. Those are subtle clues that you know that these patients are not comfortable with others seeing their skin. And I think that's why it's important to at least acknowledge it and say, I understand, and I want to try to make sure you know I'm not overlooking that part of treating you. I'm not just here to give you a prescription to try to make you better or offer you a treatment and try to make you better. I do want to do that, but I also want you to know I get it. Now, sometimes I have patients who have been severely depressed because of their rapidly progressing vitiligo, because of being ostracized by their communities, especially in some Southeast Asian cultures such as the Indian subcontinent and other parts of the world in Africa and South America. Those patients, I think, do need help from either a psychologist or a psychiatrist and using a multidisciplinary approach. I've had a few patients over the years who've had rapidly progressing disease where their own body's immune system completely depigments them on their own. That's exactly what happened to my brother. And there's some patients who you try to repigment completely or try to get color back, and you're just not able to do so. And in those patients, you really need to take a step back and have a discussion about how are they feeling after having failed phototherapy, excimer laser, multiple topicals, systemic steroids, antioxidants. What do they want to do in their next step? And a vast majority of the patients who are at that juncture may say, all I want is to be an even skin tone. All I want to do is be able to go to the mall and walk around and not be stared at. And in those patients, I think depigmentation therapy with monobenzyl ether of hydroquinone topically is an option. So I'm not saying that that is an option for each and every vitiligo patient, and you need to be offering that to everyone. But in the setting of a patient who's either have rapidly progressing unstable disease or who has failed a lot of treatments and is struggling, I think it's important to be able to let them know, I have something to do the opposite effect for you and at least even out your skin tone. And I've had many patients who I've depigmented who end up being very, very, very happy that they at least feel like they have some sort of even skin identity. I think my patients have been, who have been depigmented, have really benefited from increasing in their self-esteem, have benefited from feeling like they don't really have a stigma associated with the way they look. Now, I've had some patients who are, for example, African American skin types 5 and 6, and you depigment those individuals. It's important to let them know you are not going to look like a skin type 5-6 individual ever again. You're going to look more like a skin type 2-3 individual. And that culturally, I think within their own cultural population certainly has some psychosocial impact. And some people who do a lot of depigmentation advocate that anyone who undergoes depigmentation therapy should have a psychological evaluation before doing it. I think that certainly has a role. I don't mandate that. I have been privileged to develop a relationship with the majority of my patients over time where I feel like if this is ultimately where we end up, I'm willing to do that for them and guide them through that journey.